Good morning and welcome to UBLUR TV. I'm your host, Brad Harmon, and today my guest is Dr. Trey Rigert with Columbia Pain Management in Hood River, Oregon. Dr. Rigert, welcome to the broadcast.
Good morning, Brad. Pleasure to be here.
We're grateful for you taking your time out of your busy schedule to join us. Now, Dr. Rigert, over the last few weeks we've been talking a little bit about the changes that they're making to Vicodin and how it's becoming a Schedule II controlled substance, and the possible changes that will make for prescribing it for pain medication for long-term chronic pain. One of the things that's kind of popped up that's a bit of a concern is, what if they can no longer get their medicine because their doctor changes the prescribing practice and doesn't want to prescribe it anymore, or if people have just decided that they no longer want to use it because it's a Schedule II type medicine? What can they do to stop using Vicodin so they won't have to suffer with the terrible withdrawal symptoms?
Yeah, that's a great question, Brad. So we know that coming up here on October 6th, Vicodin will be a Schedule II, which is in recognition that it has a higher risk of addiction and abuse than was originally thought. What that means, practically speaking, is that Vicodin can no longer be called in. People will need a handwritten prescription, and they will no longer be able to receive refills on the medicine. So we suggested earlier that it's a good time for people to sort of stop and take a deep breath and decide, is the medicine, if they're taking it, really doing what it's supposed to do for them? And if they decide that it's not, if they decide that the medicine is more harm than positive in their life, it's a good time to do something. And then we'll also have to admit that there will be physicians that aren't comfortable prescribing Vicodin anymore. So what can you do? One very reasonable choice is just to taper off with the assistance of your provider. Some people actually don't have much withdrawal if they taper off, and they feel pretty decent. Increased pain after they stop the medicine. That's what we call post-acute withdrawal. For those folks that have that really difficult withdrawal syndrome, have a really hard time coming off the medicine, what is there to do? One solution that we deploy is the medicine called buprenorphine, which is a substitute for the Vicodin, the Hydrocodone, the Norco. It's another opiate, but it is a Schedule III opiate. It's felt to have a better safety profile, so there's less risk. It is felt of overdose and addiction. It comes in a patch. It's called Butrans, and it comes in a tablet that you can melt under your tongue. There's a bit of a process to make the transition, so people would have to speak with their provider or someone that prescribes the medication about making the transition. But we've had a couple, 300 people now make the transition and be happy with their pain control, avoid the protracted withdrawal, and are doing quite well. For those folks that decide they don't like the medicine and are able to taper off easily, that's obviously a superior solution. And then you can move to medicines perhaps like gabapentin or Tylenol for your pain control and be in a good spot. But for those folks that can't, and we've seen on our comments section, some people can't, buprenorphine can be a very viable option.
That's good to know. We appreciate you taking your time to share that with us. Now, so summing it all up with the big change with the Vicodin to Schedule II controlled substance, what do you think the big takeaway is for chronic pain sufferers right now because of the change?
Yeah, the big takeaway right now is to contact your physician or your mid-level provider, get in and make a plan. For those folks that have refills right now, they do get a little breathing room because we do have guidance that most of those refills will be honored till next spring. But don't just assume that everything's going to be the way it was. Now's a good time to talk to your family, ask them, has this made a positive change in my life? Talk to your provider. What's it going to be like to get my medicine from here forward? And make a plan. Don't just ignore the changes and be caught off guard, because it could be uncomfortable for people that go into precipitous withdrawal.
Great. Thank you again for sharing your counsel and advice with us. We always appreciate your wisdom.
Thanks for asking, Brad.
And thank you for joining us on UBL URTV. We hope you'll tune in soon for another broadcast.